Hi folks, thanks for joining us for the SBHC Mental Health Expansion Grants Funding Formula Overview webinar. We are going to get started here in a couple minutes. We'll give folks another minute or two to jump on. Hi everyone, thanks again for joining us. We are going to give folks about another minute to join us and then we will get started. Hi everyone, thank you for joining us for the SBHC Mental Health Expansion Grants Funding Formula Overview webinar. Before we get started, I want to just do a quick sound check. In your menu on the sidebar, there should be a little icon that will allow you to raise your hand. Could you please raise your hand if you can hear me? Awesome, thank you. Seeing lots of hands being raised. Just some quick housekeeping before we get started. This webinar is being recorded and we will be posting it on our website in the coming days. Everyone is being muted for the webinar, but there is a chat box, again, on that menu on the right-hand side of your screen. We have ample time set aside for question and answer, and so when it comes to that point or at any point during the webinar, if you have questions that you'd like us to address, please enter that into the chat box on the right. All right. Here's our agenda for the day. I have an hour set aside for the webinar, but I don't think we'll be using that whole time. Mostly, I just wanted to give folks some background on our funding formula, give a quick overview of what our changes are for the 2019-2021 biennium, make a quick update about some contracting policy changes, and then the majority of time I really want to set aside for question and answer to make sure that if you have questions about any of this information that we can address that now. Okay, so starting off, I'm going to talk about the background about the SBHC Mental Health Expansion Grants. So some of you have been around for a while, you probably know this information, it might be an overview, but these grants first became available in 2013 to increase access to mental health services through Oregon school-based health centers. So before we had these grants available, so from 2012 to before, less than 50% of school-based health centers had any level of mental health FTE available on site. So a lot of folks were just delivering mental health services by referral outside of the clinic walls. So this was a pretty big game changer for school-based health centers. The money came to us from the state general fund, and it was specifically to support mental health services, again, delivered through school-based health centers, and only state certified school-based health centers were eligible to apply for the dollars. We had 2 cycles of kind of competitive open applications for the funding. So the money became available for the first time in the fall of 2013 and was awarded in 2014. The process was pretty open-ended, and folks were required to submit pretty long applications for the funding. So some of you who've been around may remember this. There were like 10 pages of applications and lots of letters to submit. It was a pretty intensive process. And we repeated that process again during the 2015-2017 biennium, which was our first full biennium of funding for this program. So what kind of wound up resulting was a somewhat even distribution of funding. It just was really based on what folks had requested. It looked really different in different communities. There's just a lot of variability in what folks asked for and then what we were able to award. And the long application process was pretty arduous for folks, especially if they were smaller school-based health centers, and not everyone has their own grant writer, and so folks were kind of scrambling to complete that process and get all the required information to us. So during the last biennium, when we started planning for the biennium that we're in, the 2017-2019 biennium, we were trying to look for a better way to allocate our funding. We wanted to more evenly and fairly disperse the funding, but also account for regional variation in things like salary, the cost to recruit, et cetera. And we also wanted to kind of stabilize the funding between biennia to help folks anticipate the amount of money that they would receive to support staffing, because you know, you all are trying to plan and hire folks in these positions. It's nice to know what to expect year to year. We also wanted to create a simpler application to reduce the burden on folks, especially those with limited capacity. So in 2016, we convened a stakeholder work group comprised of representatives from the school-based health center field, and they helped us to develop this, what we're calling our funding formula for the school-based health center mental health expansion grants. And so this is really essentially how things worked. So every school-based health center that had previously applied for the mental health expansion grants received what we call our base funding of $50,000 per SBHC. And then points were awarded based on this formula. So it was the number, not percentage of students at the school-based health center host school on free and reduced lunch, and then the mental health provider to population ratio, which is determined by the Robert Wood Johnson Foundation. These points were kind of allocated on a scale, and then funding was awarded based on the points, the number of points that folks had. So it was a range of anywhere from $10,000 in point funding to $90,000 in points funding. And then additionally, this was kind of bracketed by you couldn't lose more than 70% or gain more than 150% of your previous biennium grant awards. So awards were kind of capped within those parameters. And so all of those factors taken together, that's what produced your funding formula award. And that's the amount that you were eligible to receive from our office. So if that wasn't complicated enough, there is also an opportunity to apply for additional funds with what we call pooled funds to support school-based health center mental health services, and this was completely optional. So basically, you could apply for up to $50,000 in pooled funds per SBHC to support anything from, so if you had lost money in the funding formula, you could apply for money to help to cushion that loss, or if you wanted to expand services. So if you had a new school-based health center that had not previously been funded with the mental health expansion grants, you could apply for $50,000 to support that. Or if you had a new service delivery model that you wanted to explore. So for example, if you wanted to add a behaviorist to your clinic that you hadn't had before, you could apply for some extra money to help support that position. The one catch was that the amount of pooled funds was fairly limited, and pooled funding was not guaranteed. So formula funding was kind of what you were being awarded, and then pooled was kind of like additional funding that was a little bit more competitive to apply for. And so you could apply for that, but you wouldn't be guaranteed that money. So those two pots of funding together, that would equal your total award for the mental health expansion grant. So what resulted is a pretty complex spreadsheet to determine all these award amounts, to make all these calculations. But I think the feeling was it helped us get a little bit closer to the goals that we set out to meet in terms of reducing variability and creating kind of a funding amount that folks could expect from year to year. And so basically last biennium, as most folks will probably remember, it was a pretty short application. Basically, we asked people to tell us, we said, hey, this is the amount of money you're being awarded in the funding formula. Do you want this money, yes or no? Not surprisingly, everyone said yes, they wanted the money that they were awarded in the funding formula. And then the second part of the application was, do you want to apply for pooled funds in addition to this funding formula, yes or no? And then if yes, what do you want to use it for? And then how much do you want to apply for each of your school-based health centers? So that was kind of how things were last biennium. So looking ahead to 2019, 2021, we made a few small tweaks to our funding formula. And in the email with the invitation to this webinar, you all should have copies of that updated funding formula. There's kind of the full calculation spreadsheet that you can look through if you really want to see how we made all those calculations and determinations. And then there's that condensed spreadsheet where it has each SBHC's eligible award, the award kind of calculated combined per your system, which is we called like the medical sponsor, and then the awards by county. So there's a couple of different ways to cut it. The formula for this upcoming biennium is pretty much is largely the same as it was in previous years. So we are still awarding each currently funded school-based health center $50,000, and then we award additional funds based on points for free and reduced lunch, and then the mental health provider population ratio. But then we did also make a couple of small changes to the funding formula to kind of help, again, further reduce swings in funding between biennia, and then to support some school-based health centers that don't neatly fit within this funding formula. So we have a couple centers that are located in pretty small schools but serve an entire district, or they're located in pretty large counties that has pretty big variability in terms of mental health provider availability. So the idea was that we would add another variable to our funding formula to kind of help account for this, and to also add student voice into making the determination for funding awards. So we did that by adding another points funding variable. It's a Oregon Healthy Teens OHT variable for self-reported unmet mental health needs. So we looked at factors like the reports of suicidal ideation, depressive episode, and then there's a question about, do you have an unmet mental health need? We looked at the most granular data available, so whether that's school, school district, county, or state, and we looked at how the available data differed from the state average. So there's a statewide average to answers for these questions, and then there's usually like a local school level, district level response, and then we kind of compared those two and then created a scale based on those differences. So awarded points and dollars were then based on a scale from less than 15% lower than state average to greater than 10% of state average. There were a few counties or a few school-based health centers, and you can see that in the funding formula spreadsheet, that their county, their school, their district does not participate in Oregon Healthy Teens. So if that was the case, we just awarded based on the state average. I think that was like 3 points were then awarded to that community. So again, we're going to be using this kind of same approach for applications this upcoming biennium. So there will be once again an opportunity to request pooled funds this cycle. You will again be able to request up to $50,000 per SBHC to support either funding lost in the funding formula. So if you lost funding from last biennium, you can apply for pooled funds to kind of help make up that loss. Or you can also apply for funds to expand services. So expand services or grant funding to a school-based health center that has not previously received grant funding from us. Or if you would like to explore implementation of a new service delivery model like a behaviorist, like I mentioned before. The pooled funding, again, is not guaranteed, and it's possible that we may only have a very limited amount of funding to allocate to the pool. So, for example, if we don't receive any additional funding for our program this upcoming biennium, but if we do receive additional funding, and for those of you who are on the coordinators meeting call last week, you may recall that I mentioned that there is money in the governor's budget right now. It's about $1.1 million to help support school-based health center mental health capacity. If that money is included in the governor's budget, that will go into our pool for available funding. And then that can be, folks can apply for that funding. Again, anything that you apply for, all of this funding needs to specifically be used to support mental health FTE delivered through a school-based health center. So here's a rough idea of our timeline that we're looking at for the next couple months. As I mentioned in the coordinators meeting, we're releasing this funding formula earlier than we have in the past because we know folks are already budgeting for the upcoming fiscal year, and we wanted to share the information that we have because we have it. It's not, again, not final because our budget won't be final until, unfortunately, July 2019. So as folks probably know, the legislature is in session and they're meeting and they're determining their budget for the upcoming biennium. And there's a lot of interest in school mental health and school health services, which is excellent, but there's a lot to figure out in terms of what they will be funding for the next biennium. So we really probably won't know the amount of money that our program has to work with until July 2019. So there's going to be a little bit, again, unfortunately, some uncertainty between when applications open in April 2019 and official awards are announced. But we will really try our best to keep things as transparent with you all and keep you in the loop as we know more information. But this cycle, we will still, again, have two parts to the application. It will just be, again, do you want your allotment of funding formula dollars, yes or no? If yes, and that's all you want, you're done. That's the end of the application. But then if you would also like to apply for pooled funds, again, that maximum of $50,000 per SBHC, it will be a pretty short application of, if yes, which SBHCs do you want to apply for the funding for, and then how will you use those dollars to support mental health services at your clinic. Okay, so before we dive into question and answer, I just want to give a quick note about contracting. This is hopefully not new information for folks, but just in case it is, I wanted to put this on there to make sure everyone's on the same page. So we've been, for the past year and a half, been going through a process of potentially changing our policy about contracts. We have had a work group. We've done a lot of survey and kind of getting feedback from folks, and effective July 1st, 2019, we are officially going to be making a change about how we contract for school-based health center funding. This may or may not impact your county. If it doesn't, you're good, but I still thought we should just give some information about this in case. So the change is really now that local public health authorities, or LPHAs, may now quote unquote refuse state SBHC funding and allow our office, the state program office, to contract directly with medical sponsors. So I have some visuals, if this is helpful for folks, about what this actually means. So this is what our current contracting policy is. This is the way it's kind of always been for a long time, many decades probably, of how we disperse SBHC program funding. So that includes the mental health expansion grants, that includes your base funding, that includes any other money that our program has available. So really what it looks like is everything goes through local public health. So SBO, again, is the SBHC State Program Office. That's where I work. And then LPHA is local public health. And so in some cases, our office directly passes the money to the local public health, and they use that money to fund their school-based health centers. So they're the medical sponsor of their health centers. They provide mental health services. It's all kind of in-house at the local public health authority. But then in other cases, local public health maybe does not want to be involved or wants to have somewhat more limited involvement, or they don't have the capacity to provide clinical oversight. And so then they subcontract funding to a medical sponsor or a mental health agency. And then those entities provide those medical and mental health services for the school-based health centers. This is a little bit of an oversimplified model, as many of you can probably attest to. So there can be different variations on this depending on who the local partners are. So for example, a medical sponsor may provide both primary care services and mental health services, and so in that case, all that money would go to the medical sponsor. Or sometimes the local public health department provides the medical services, but then subcontracts for the mental health services only. But in all of those cases, the money is going through local public health. So with our new policy change as of July 1st, there is a third option here. So the third option, the local public health, is kind of out of the equation. So local public health can say, you know what, we really don't want to be involved. We don't have capacity to do this. Please contract directly with the medical sponsor instead. And so under this scenario, the state program office, our office, will contract directly with the medical sponsor, and then all funding will flow through that medical sponsor. So if the LPHA refuses money, the state dollars in the state contract, we will put all of our money through the medical sponsor. So that includes the mental health dollars as well. And so then they can either provide those mental health services, or then they would subcontract with the mental health agency to provide those mental health services. So essentially, what does this mean for you all, for the mental health grants? So if your local public health authority maintains their state contract, there will be no impact to you. It will be exactly the same as it's always been, and you will still get your funding the way that you always have. If your local public health authority allows for direct contracting, then, like as I said, all the state dollars will go through the medical sponsor agency, and then the medical sponsor could then subcontract for the mental health services if they decide to, if that's applicable for your community. One quick caveat to that is that these decisions are made by each county health department, and so the relationships may be different in different counties. So some of you have multiple counties with school-based health centers. Excuse me. So you may have SBHCs in like 2 or 3 different counties, and so those relationships can look different depending on the county. So if you have questions specifically about the contract piece of this, there will be a contract question and answer call on Wednesday, the 13th at 3 p.m. You can call into that number to access the call. It won't be a webinar. It's just an open Q&A. So you can kind of get more information about the specifics of that contracting. And then you can also talk to your local public health administrator and local SBHC partners to learn about their plans for the SBHC program contracting during the upcoming biennium. So a lot of those decisions are already in process. They're being made locally. And we actually don't know yet what those relationships will be. So probably your most accurate information will come from your local communities. But if you do have questions about the state contracting piece of things, Rosalind Liu, our team lead for the SBHC program, is your best contact, and her information is on the screen there. So please reach out directly to her. Okay, that was a lot of me talking, and I wanted to open it up now for questions if folks have them about the funding formula, the mental health grants. What can I answer for you? And again, please type those questions in the question box, and we will just read them as we get them. Questions yet? You have done an excellent job explaining things. I mean, it's also okay if we don't have questions. Oh, there are a lot of questions, actually. So, are the points added before we see the amount? So, I think if I'm understanding your question correctly, so it's all in that spreadsheet. So if you want to see exactly how the points funding was calculated, it's that base $50,000, and then the money for the points funding is all based on those columns where it says like free and reduced lunch, mental health indicator, mental health provider to population ratio, and then it's all calculated in the spreadsheet that determines that amount. So if you look at the all calculation spreadsheet, you can kind of see how those dollar amounts were awarded. Next question is, can you provide more detailed guidance about how pooled funding will be prioritized? So right now, I don't necessarily have that information. It really depends on how much money we have to work with. In the past, we've looked at the priority has gone to counties that do not currently or had not previously received funding from us to support mental health services, or clinics that did not have mental health capacity on site. We're at a point right now where every county has received some level of mental health funding from us, and every school-based health center has a provider, a mental health provider on site. So I think we haven't really determined quite yet what the funding priorities will be for the pooled funds, but it will probably be looking at unmet needs somehow. And there will be a lot more information provided about that once applications are officially released in April. What is the difference between the award by SBHC system and award by county? So some counties, system and county is the same. There are a couple counties, though, that have multiple medical sponsors, and so we provide the information by county because, again, the counties have the contracts, and so they like to see the amount of money that they'll be getting in total. And then we also divide it up by system, which is what we call medical sponsor. And so sometimes counties, like I'm looking at Deschutes County, for example, they have award by county, but then there's also 3 separate medical sponsors, and we kind of break that up just so folks can see by those different medical sponsors. Where are the applications, or will they be sent out? So the applications aren't available yet. We just released the funding formula now so that folks have a general sense of the amount of money that they might be awarded for next biennium. The applications won't be released until April of this year. Are we still able to apply for the $50,000 per SBHC in pooled funding? So yes, that is our intent, is that folks will be able to apply for $50,000 per SBHC in pooled funding this upcoming biennium. Again, we unfortunately don't know the amount of money that we are going to be able to work with. So if we are flat funded right now for next biennium, I think we only have, like $100,000 to work with in pooled funding, which is not a lot. That would get eaten up really quickly. But we are hoping and anticipating that we'll have a lot more money to work with pooled funding. And then in that case, yes, we would encourage everyone to apply for what they they feel like they need to support mental health in their clinics. We are a system of 10 SBHCs, and funding is allocated to 4 specific sites. Are we able to change any of those 4 sites? Yes. So in the past, I think I did leave that out. In the past, we did also, when we did the funding formula, we asked if you wanted to change the sites for which you were allocated money to support mental health services. So some of those bigger systems, they maybe aren't receiving grant dollars for all of their school-based health centers. And you could certainly say, hey, you know what, we would like to shift services, grant money to a different school-based health center to help us with these services, and that's totally fine. You can definitely do that. You're definitely not like locked into one SBHC if you've received funding for that clinic before, if you want to shift it somewhere else. Can another entity like a school district decide to apply for direct funding, or does the LPHA have to decline first? So the local public health department does have to decline first in order to open up the ability to contract directly. It would probably, I think, I mean, this is maybe a question for Rosalind on Thursday or on Wednesday, but I believe it does have to specifically go to the medical sponsor because that agency would then be the one providing the medical services at the clinic. I don't believe it would be open to education entities. How should we prepare for documenting our budget funding in the operational profile? I don't think that that's necessary. I mean, please do keep your operational profile up to date with your current financial information, but last cycle, we didn't actually ask for a budget or kind of any of those documents with the application. The way it worked last biennium, or this current biennium, is we made the funding awards based on the funding formula and then the pooled funding applications. And then in July, I contacted folks and said, hey, this is your total funding amount. Please tell me how you are going to be using it to support capacity at your school-based health center. So how many FTE are you supporting? What's your general budget? But you won't have to submit like a huge budget or anything with that initial application. And again, I'll put more information about that application process in April when that becomes available. Does that answer your question? Okay, great.
I think we're caught up on the questions.
Okay. Anything else? Okay. Well, thank you everyone for your thoughtful questions. I hope this kind of helps folks get a general sense of what funding will look like. Again, this is kind of not the last word on funding for the mental health grants. So I'll definitely keep you updated as we know more about what our budget will look like. And then again, those applications will kind of open in April. And so we'll give you plenty of advance notice about that. And then once those applications open, we will have another kind of open Q&A call if folks have questions about the information that we need or documentation or kind of anything like that. So we'll have space for that. So again, here's my contact information. If you have questions or, you know, as you are looking over these things, please feel free to reach out to me. Oh. Can we have access to the underlying data used for your formulas? Sure. I can, let's see. I wonder if it's actually cited on here. I can send you a link to the Robert Wood Johnson one. The free and reduced lunch is from the Oregon Department of Education. It's their 2017-2018 school year information. Is it sure? Yeah, 2017-2018. So that's all publicly available. And then the Oregon Healthy Teens data, it's also publicly available, but I can follow up with links for all of those things if folks are interested. Yeah. Yeah, the granular healthy teens. Sure. Yeah, I can send you. So sorry. The question was, I'm thinking of the granular healthy teens data. So yeah, I can send a link to where we got that information. And again, all of this, we kind of we looked at the local in comparison to the state and then created a scale based on the differences there. But you can see like the raw information. And let me see in your case. In your case, there was one in which it was school level and the other in which it was county level. So it depends on if your school participates in Oregon Healthy Teens or not. That could impact your score a little bit. Let's see. But yeah, I'll follow up with you, Deb, and send that information to you. Okay. Well, if that's it, again, here's my contact information. Please do follow up if you have questions, and we will make a recording of this webinar available on our website in the coming weeks. Thanks so much, everyone.